I'm Jeffrey Woldt, Editor-in-Chief of retailmediaIQ. Welcome to our coffee chat. Today we're going to be speaking with David Pope, Chief Pharmacy Officer at XiFin. David, great to see you.
Good to see you as well, Jeff. Thanks for having me today.
You've been in the pharmacy business a long time, and I'm wondering if we could start off just what you see as the most significant trends in the field right now.
Pharmacy is moving quickly. We've seen the advent of AI and the adoption of that. We've seen that be pervasive across all of pharmacy, specifically in the operational areas, right? Again, we may not be ready as a healthcare landscape to be able to adopt AI that begins to diagnose and treat or anything like that. We are solely focused on making it easier to be a patient seeking care at a pharmacy and to make it easier to be a pharmacist providing that care. And so AI has certainly been a major focus of that, whether that be in trying to gather information more easily, more quickly with a patient to be able to gather, for example, the medical benefits card and that information using AI to be able to do that, to be able to communicate quickly and with patients. Certainly AI has been truly a focus there. It's also been a focus of medical billing. Again, as we all know, whether it be pharmacy billing or medical billing, there needs to be a reconciliation that occurs there. There needs to be something that communicates back to the plan at times, to identifies specific needs there, whether it be a rejection and an update needed. AI is being used in that regards as well. So certainly AI is a heavy focus in pharmacy. We're also seeing a big movement right now in food as medicine. And so food as medicine has been an incredible focus there, again, as we have our drug food combos that are focused on providing key care, again, combining both the grocery side as well as the medical billing side as well. And so we're excited about that and seeing that movement as well.
What do you see retail pharmacies tackling first? What direction are they headed?
Sure. So clinical services still reigns king, right? So from a pharmacy perspective, becoming the front door of healthcare is a focus. And so pharmacies everywhere are beginning to bill for an office visit, for example, right? So again, treating those patients who are both sick and then combining that with value-based care opportunities, those well visits, if you will. Of course, food as medicine is a part of that as well. But certainly we feel like and what we continue to see is a heavy focus on clinical services, on the contracts that are needed and with the plans, the infrastructure that's needed to be able to do that testing, but ultimately the technology to make it easy to do those types of things, from gathering the plan to ensuring that we have an easy way and an exact way of being able to say, this is how much you should charge your patient, this is what's covered, and this is when it's not. And providing those easy guardrails so that it's easy to implement and it's scalable. That's what we're seeing paramount today. Certainly another area, though, that we're seeing a heavy focus on is the specialty business. Again, specialty medicine is certainly has been around for a long time at this point right now. It's always and ever changing. Right now we're seeing a shift over to the medical benefit. And so according to our most recent, for example, XiFin Pharmacy Transformation Survey, we did see over 20% of respondents said that they're seeing a pretty big shift into the medical benefit. And so that requires a couple of new things, right? We're going to do prior authorizations differently. We're going to contract differently. And so we're excited to see that as well as a positive movement within the pharmacy landscape.
In those two areas that you mentioned, specialty pharmacy and also clinical services, how do you see the business evolving in terms of how it relates to the patient?
Pharmacies and pharmacists, I being one of them, have always held that unique relationship inside the neighborhood of the patient oftentimes, right? And that connection allows for greater communication. And so pharmacists and patients are excited about that, as well as, again, as pharmacists and pharmacies begin to offer these clinical services and saying, in conjunction with my doctor, I know that if I go and see my pharmacist, that, again, I might be able to be treated for flu, for strep, for COVID, right? To be able to receive a hormonal contraceptive or many other things as well. But I also know that that's just one cog in the wheel of a greater healthcare system that's treating me. And so what I love about this is that pharmacists are not on an island. They're communicating with physicians. We've got robust ways to be able to communicate out, both there and to and from. Certainly, we've got a ways to go in terms of interoperability, but I'm so pleased to see what we see in the marketplace is a willingness on the side of course, the pharmacist to say, this is what I've done, but of course, on the physician side to say, here's what I have. I appreciate you helping me to treat this patient. Many times they're held to value-based care contracts as well, and so we see the pharmacist and the pharmacy as a major part of that operation.
What other barriers do retailers face as they want to expand in those two areas that we've been discussing?
Sure. So, as we talk about specialty and clinical services, food is medicine, I mentioned a moment ago. I think the big piece here that we're seeing is how do I scale this? Again, pharmacies are great at doing some pilot programs. Mm-hmm. And so, again, having a specialist there, having a pharmacist, who's dedicated to it, makes it easy, right? But we know that that's ultimately not scalable. We need to be able to have these systems available so that we can have the pharmacist there and can do the majority of these types of services as long as they're qualified and trained to do so. And so we see that technology is a potential barrier, right? Again, if they don't have the technology to be able to gather that information quickly, ultimately to be able to say, you are eligible. That matters. And so again, whether that be clinical eligibility and guidance there based off state guidelines and beyond, or in the area of medical billing and to say that this patient is covered for this service in my pharmacy and what does it cost? Those types of things, especially as we get into the office visits, can be a barrier if you don't have that technology available to you. So what we're seeing today is a massive transformation where pharmacies are beginning to say, I have in order to address that, I have a pharmacy management system that's filling prescriptions, that's connecting with the patient, that ultimately is the patient record for prescriptions. And then I also have an adjoining electronic health record. We never thought that would ever happen a long time ago, right? Again, but yet and still, now that the pharmacist is seeing a patient as an office visit, it's now time for us to be able to have a dedicated electronic health record designed, built for pharmacists. And so we're seeing a massive transformation there as well in order to overcome the barrier of eligibility. One of the things that pharmacists are focused on now is having an electronic health record that still provides that price transparency along the way, right? That says, here's an office visit, patient's covered, and let's try a flu test first, right? And then that combined would be this cost. Now that's negative, we need to go to a strep test, let's just say. And so providing that new documentation, but also being able to provide that eligibility in an updated copay. We know that patients are going to expect that from a pharmacist to be able to say, now how much might it be for this next test? So providing that really breaks down that barrier. It's exciting to see. Mm-hmm. The final thing, Jeff, I would just say is just from a medical billing standpoint, the barrier here is still payer agreements. There's been a lot of talk about credentialing out there. And again, about how do we connect with plans? Certainly, credentialing is a major factor in Medicaid space. We don't see that quite as much today in the commercial space, but that may change over time. We're not asking pharmacists to be treated any differently than a physician or anything like that. But certainly, there is a challenge in that sometimes plans want you to connect and engage with them on a pharmacy or organization level. Sometimes they want you to engage with them on a pharmacist level. And so the scaling and the challenge of that is certainly something new for our pharmacies. And I think that's an exciting thing for both sides.
David, a final question. As XiFin works with clients to help overcome these barriers, what advice are you giving retailers as to how to approach these problems?
Sure. So, from a XiFin perspective, we are the subject matter experts. We get to see the majority of claims in the country today for medical billing. And so we're excited that pharmacists are engaging in this way. We see this being bluer seas, honestly. We see there being expansion of revenue, right, and diversification of that revenue. And so we're encouraging our pharmacists to consider that. Again, everyone's different. Every pharmacy is different in their location. But we do know something that is universal, and that is that patients need their pharmacist inside their communities. And so, again, we encourage our pharmacies to be able to engage in that way with clinical services, to expand services beyond just immunizations, which is an incredible offering that they have to the community at the same time, but to expand beyond that and to practice at the fullest extent of their capabilities and license.
Well, that's a great service, both the thought leadership and the technology. So thank you for filling us in, and great to see you as always.
Same with you, Jeff.